Hello, welcome to HealthWatch. I'm Sophie Scott. Imagine going to the doctor and being prescribed drugs based on your own DNA. It sounds far-fetched, but it's already happening in Britain and the United States. And in Australia, this tailor-made medicine is set to change the way some illnesses are treated. When it comes to taking medication, it seems we're not all created equal.
Between 1 in 2 and 1 in 3 people, when they go to a doctor to get a medicine, the medicine doesn't work, or 1 in 200, 1 in 300 people, they get a toxic reaction.
That's related to differences in our genetic makeup. To overcome it, scientists have developed tests to see whether a drug is safe or if it will work. Professor Anne Daly is leading the move towards personalised medicine in the UK. A clinical trial for a common blood-thinning medication is already underway there.
We're beginning to understand more about the actual genes that are involved, and we can start to test people for particular genes and then decide what medicines to give them and how much of the medicine to give them.
Australian experts say the science will change how we treat many common conditions.
In 5 years' time, we'll have genetic tests available to the GP who can actually do it, or the GP assistant to allow them to do that test at the GP clinic.
Already in Australia, the science is being used in HIV medicine and on thousands of women taking breast cancer drugs.
For people on tamoxifen, we know that through this genetic test, we can determine whether they're going to respond to the medicine or not.
The experts stress that not all drugs will have genetic tests, but for those that do, it will mean safer and better results for patients in the future. Australians needing cataract surgery have been caught up in a political row. The Senate has again disallowed a government attempt to slash Medicare rebates for cataract surgery. Caught up in the row are thousands of Australians desperate to have their eyesight restored.
Cataract surgery restores the sight of thousands of Australians each week, like 79-year-old Merv Simmons. He had the operation on Thursday. On Friday, Medicare and his health fund rejected his claims.
I said, sorry, we can't pay you. But as from the night before, all benefits for that item number had ceased.
There's confusion over what should be paid because the government tried to slash the rebate by half, but the Senate disallowed the move. The government's pressuring ophthalmologists to reduce their fees to reflect technological advances that have made cataract surgery quicker. Ophthalmologists argue their high-tech equipment and staffing expenses justify their prices. They're running a campaign warning any cuts will cost the whole community.
At a personal level, patients are facing gaps in the many hundreds of dollars, but at a systemic level, as the patients shift from the private system to the public system, that is going to cost many tens of millions of dollars.
Other medical practitioners say ophthalmologists are being greedy, wanting too much of the taxpayer-funded Medicare pie.
I find it a little bit difficult to understand when I can visit an oldie in a nursing home for an hour and a half, and get 1/10 of what a specialist ophthalmologist might get for doing a quarter-hour procedure.
For now, the government has directed Medicare to pay out 40% less on the rebate, but the Senate could reject that too. Australia's largest seniors organisation is calling for an urgent end to the uncertainty.
Medicare, private hospitals, all mixed up, uncertain of what's happening, and that's just exacerbating the problem and exacerbating the uncertainty and worry for older Australians.
It's a bit of a disgrace, really.
Despite talks breaking down, ophthalmologists say they will keep negotiating with the government. Meanwhile, the future remains unclear for many eye patients.
That's all for now. See you next week.